13 is on your side.
Welcome back into Evening Plus. We're going to talk about a new program here in our community via Northstar Care Community. That is a hospice facility here in the West Michigan area. And they're launching this new program surrounding Beads of Courage. It's really empowering folks and their families who are going through the understandably difficult hospice experience. I am joined here in studio by Dr. Brad Hemker, Pediatric Hospice Medical Director at Northstar. Brad, thanks so much for being here. We appreciate it. This project really kind of struck me because, you know, I think hospice is a topic that people don't love to talk about, but that is what you guys are all about, and really making that experience dignified and supportive and, you know, really just a caring and understood experience. So tell me a little bit about this project. Where did this come from?
It really is a wonderful partnership between Hospice of Michigan, Northstar Care Community, and Beads of Courage. Beads of Courage has been around for quite a while. They're a arts and medicine program that has designed beads and are part of 300 hospitals around the country. Wow. They design beads that really are symbols of a child and a family's medical journey. So think of a child with cancer, for example, going through chemotherapy and surgeries and clinic visits, hospitalizations. They have a bead for each of those. And it's really a tangible sign of that journey the child's been on. Yeah. So they're able to have that strand of beads and show at the end of their journey, in the middle of the journey, look what I've been through. And they carry that across the stage at graduation and other events. And it's a really wonderful, concrete way to show how much they've been through all along the way. Really
a moment of empowerment for them, for sure.
Yes. Yeah.
And so bringing that into sort of the hospice field, how are you guys kind of taking your own spin on it?
Yeah, and so the program's been wonderful, but what it's been missing is, unfortunately, and it's reality, at times that journey for that child may also mean a journey towards end of life, a journey towards hospice. And that's where Northstar Care Community and Hospice of Michigan come in and provide that care. But Beads of Courage has never had a bead to represent that. And as you mentioned in the beginning, sometimes hospice is not what people want to think about or talk about, and certainly not in the pediatric world. Yeah. But unfortunately, it is a fact of life for some of our families, for many of our families and children. And what this bead is a chance to commemorate that, to still celebrate that, and to celebrate the resilience and the courage that child and family have to take that step in their journey as well.
Yeah, really keeping, you know, the same moment of empowerment. Obviously, it's a different scenario than, you know, for example, leaving the hospital after a chemo journey, but, you know, it's still a moment where you want someone to feel powerful and respected and know that what they're going through is really tremendous.
Absolutely.
And so I know part of the program is, you know, for the patient specifically, but also kind of for their family to play a role in this, as you were kind of getting at. So walk me through a little bit of how this works.
Yeah, absolutely. So there's a bead for the patient, right, to add to their strand. But another really cool part of the project is there's a bead for the community to participate. So we're inviting the community in general to do what we call carry a bead. And they get that same bead that they can take with them to whatever milestone they're facing, whether it's running a marathon, climbing Mount Everest, going to the beach, whatever cool thing they're doing that they're celebrating, we want them to carry that bead and ideally then send that bead back to a hospice patient with a message of encouragement that says exactly what you just shared, that we are still thinking about you. We are with you on this journey. We want you to know that we still care. Even though things are not going where we want them to, we still see you, we still love you, we still care about you. And it's an opportunity for the community to really wrap their arms around these children and families facing really unimaginable circumstances.
Yeah. And I don't know if this was, you know, originally the thought with what you just explained, but it also feels to me sort of like, okay, if someone else is able to, you know, share going to the beach or finishing a marathon with someone who maybe is at a point where they can't leave a care facility, it's almost like they were there with them doing all of those things and can kind of share in that experience, which I'm sure is so uplifting.
Yeah, absolutely. As you can imagine, going through this type of medical journey, especially entering hospice care, can be remarkably isolating for that child, for that family. None of us can imagine what that's like unless we've gone through it. Yeah. So this program is another part of the broader approach of Northstar Care Community to really show kids and families that we do care and try to take away that isolation by inviting the entire community to be part of that journey. As sad and heartbreaking as it can be, bring some beauty and joy to those moments as well.
Yeah, and so if people at home are hearing about this and they'd like to be a part of that, sort of wrapping their arms around folks who are going through something so unimaginable, what does that look like?
So they can reach out through our website about the Carry a Bead initiative and find information about how to get a bead and what to do with it afterwards, and many more details about how this works and how they can be part of this journey of a child.
And I know this is, relatively new, sort of just getting started. Have you guys gathered any feedback yet at this point about the impact this is having, or is it sort of too early right now?
It's a bit early.
Yeah.
We're on the front end of it, but I also have really the privilege of being a bedside hospice physician for children. So I'm in families' homes, and I know the impact of this care in general.
Yeah.
And knowing that there's a community that's still thinking about that child, caring for that child, I know what this impact will be. I know how impactful that message will be to these kids and families.
Definitely. All right. Well, Dr. Hemker, thank you so much for being here and talking about this. I think anytime we can highlight topics that maybe are a little uncomfortable to talk about, it's so important to do so, because there's people here in our area who are dealing with this, or have family members who are dealing with this, and it's something we have to talk about. So thank you so much for being here. Again, you can head to Northstar's website if you'd like to learn more about how to be a part of this and really supporting those members of our community that are going through something so difficult. Thanks so much again for being here. We're going to take